It's time now for Ask the Surgeon, brought to you by Everett Bone and Joint. Everett Bone and Joint, the best choice to get you back in the game. Learn more at everettboneandjoint.com.
All right, welcome back to Health Matters. It is Ask the Surgeon, brought to you by Everett Bone and Joint. Our guest, Dr. Howard Barker. And the topic we're going to talk about, it's kind of near and dear to my heart because I was in the shoe business for 25 years, and I've seen a lot of these. It's bunions.
You are a bunion causer.
Bunion causer. I feel responsible.
A former bunion causer.
I feel responsible for some of the bunions just by saying, "Hey, those look really good," and you know that sealed the deal. But so, what is it? Tell me, what is a bunion?
A bunion is actually an angle of deformity of your great toe, your big toe, and the bone that comes down to the metatarsal. So it's not a bump, it's not a growth, it's the angle. And you can make your own bunion by just taking your finger, pointing it straight, and then bending it at the knuckle, and you've just made a bunion. That's a bump.
So then actually it's not a calcium deposit?
It is not a calcium deposit.
But that big bump then is just a change of the angle of that joint then, right?
Correct. So if you can put the toe back straight, then there's no more bump.
Okay. So you go from bend, bump, straight, no bump. Why I've seen some bunions and that bump looks all red and inflamed and irritated. Is there soft tissue damage or irritation going on there?
It's the shoe.
It's the shoe.
Blame it on the shoe.
It's the shoe pushing on the bump. So you can either change the shoe to fit the foot or change the foot to fit the shoe.
Now, there's that fluid-filled sac, that bursa that sits in there. Does that become inflamed?
No,
if it's just
there's not really a bursa there.
Okay.
It's bone and a little bit of a ligament and then skin.
Now, aren't bunions also hereditary too?
They are, but that's much, much less common than caused by bad shoe wear.
Okay, so here we're
getting... It's not just women either, too, right? Guys can get...
men, men get it.
Too.
Most of men's are hereditary, though. Unless you live in the South or in the West where you wear a lot of cowboy boots.
Okay, so it's that pointed shoe that everybody likes so much these days. When you squish that toe together...
Especially with a heel.
They just look so good.
Okay, let's get back to that.
That was the problem of being in the shoe business.
Well,
all you had to say was, "Gosh, those look really good on you."
Great.
Yeah. I'll see you in 6 months with a bunion.
And then they hurt. And I go, you know what? Sometimes you have to play with a little pain. And that was it. That was the...
Mechanically, here's the deal. So if you're forcing that foot to be compressed into that tight, narrow shoe box or toe box, we call it, and you have high heels and driving that's going to potentially create a bunion because you're driving that toe over?
Absolutely.
Okay. So your recommendation is what then?
Oh, keep doing them and then come see me. We'll fix them right up. Stay away from those shoes. And, women understand that. If you go to a fancy dinner and you look underneath the table, none of them are wearing their shoes because they all hurt. All those fancy shoes hurt. So you're only wearing them for show, and then they take them off while they're eating dinner and they put them back on. But they don't fit.
Right. So if a good-fitting shoe or otherwise a poor-fitting shoe is contributing to these bunions. Hey, I've heard of a bunionette. I mean, is there any such thing as a bunionette? What is that?
Bunionette is the same thing with your little toe.
Okay.
Oh.
Okay, and is that all... I've also heard that isn't that a tailor's... Is there some kind of a tailor's situation? I mean, you never heard that?
No.
I think I've heard the little toe, the fifth ray or the fifth toe. Sometimes it gets a bunionette on it.
It's a bunionette. It's for the fifth. A bunion is the first.
Okay, there we go. Let's get very specific here. A bunion is the big one. A bunionette is the little one.
That's right.
If you're keeping score with us at home. So, age-wise, I mean, do kids get bunions?
They do. Those are
hereditary,
and those are much harder to deal with surgically as well. And they're just born that way, that the first metatarsal is coming out more towards the inside of the foot, and so the toe has to go in or out, I should say, the big toe, and that creates that angle. They're much more difficult surgically.
And is the only way is it surgery? Can you deal with bunions without having surgery?
Bigger shoe.
Okay.
A wider toe box.
And that'll take care of it? That'll flatten everything out?
Nope.
Oh.
You still have your bunion. It just doesn't hurt.
Just makes life a little
easier. The only way to change the shape of that bunion is with surgery.
But if you decompress or take the pressure off that bunion, it shouldn't be as painful as jamming it down into a tight toe box.
It doesn't hurt, and you never operate on anything that doesn't hurt.
Right, absolutely. Good point. So if I'm wearing a shoe, and at the end of the day I've been on my feet a lot, and my bunions hurt, I'm in the wrong shoe.
You're in the wrong shoe.
So what kind of shoes should I be in then?
Something with a wide toe box that laces up.
Tell us about the toe box. I mean, in the shoe portion, let's talk about the
toe box is, if you take the bumps where the bunion is over to your little toe, in between that, those are all the metatarsal heads where the base of the toes are. And that distance between those, that's the toe box where your toes hang out. So if you have something that is a slip-on shoe, then it's being held on there and your heel. And so automatically it's putting pressure there. So a lace-up shoe goes across the middle of your foot, and so you don't have pressure in your toe box because you can have a nice wide toe box.
Right, okay. You brought up a good point when you mentioned at dinner all the ladies in the fancy high-heeled shoes have them off. I remember when I first moved to Seattle and I would be in downtown, right before work, and all these professional ladies, they were all walking around with tennis shoes on these nice dresses, overcoats, and their high heels were in their purse. So, once again, you got to decompress those bunions, take the pressure off them. Now, if a person does require surgery, when and how and why?
The surgery is done for pain and pain only. It doesn't matter what the deformity is. It matters that if it hurts or not. And if we can't get them comfortable in any shoe, that's when we start doing it. There is a nerve that comes right along that, and sometimes that gets stretched enough that it just hurts all the time.
So the only time you do surgery is for pain relief.
Correct.
You're not going to do surgery because of cosmetics. If someone comes in and says, I just don't like the look of my feet, they're
going to have to find somebody else because my criteria is pain. Because here's the situation. If they come in, it doesn't hurt, it's ugly, doctor, fix it, great. So I straighten them out, and what if they're one of the 2 or 3% that they're actually painful afterwards? Great. Now they have a nice, beautiful, straight foot that hurts all the time.
And then they're not real happy with you then.
Well, they shouldn't be happy with anybody.
Yeah, okay.
Now, I used to see all these. And I was at this very popular shoe place in the Seattle area. I'm not going to name names, but I used to see all these really old ladies would come in with horrible bunions, and occasionally they would go have surgery, and it seems like they were recuperating forever. How long does it normally take to recuperate from that?
Good question.
It depends on how much you have to move the bone. Sometimes we can just move the one part of the bone over just a little bit and put a little simple screw in there, and then they get to bear weight immediately. Others, I move the whole bone. I cut it in half all the way along, 1.5 inches, and move it over, put 2 screws in it. They don't get to bear weight for a month at all.
Wow.
But is there a certain age, if you're, that you wouldn't do that to?
No.
Okay.
Not age.
So that would help?
Just health.
Okay.
Now, just to let everybody know, listen, you have a fellowship in foot and ankle surgery.
Correct.
So you did your normal residency and internship in orthopedics, and then you did an extra year, is that right?
That's right.
Just in foot and ankle surgery.
4 years of medical school, 5 years of internship and residency, and an extra year of foot and ankle fellowship.
Wow. So how often do you see these, and how often are you surgically repairing these or fixing or correcting them?
Is it getting better?
No.
It's getting worse?
Or has it changed at all?
I don't think it changes, except, right now, the fashion, unfortunately, is back into really pointy, high-heel shoes.
You got to see. Have you seen some of those shoes? They look like an arrow.
Yeah, and 4-inch heels is now a common heel size, and you're just cramming them down in there.
Mm-hmm.
So, once again, it's just pressure and poor shoe fit.
And if you're just tuning in with us, by the way, this is the Ask the Surgeon segment. We're talking about bunions with Dr. Howard Barker from the Everett.
It's a glamorous thing.
It is, isn't it?
Yeah, it sounds like it, yeah.
Isn't there, and, again, this is right in my wheelhouse. I know all about, fashion and shoes, but aren't there companies that are making high fashion, better fitting, comfortable shoes, right?
There are. We earlier before the show we were talking about Taryn Rose, and she's an orthopedic surgeon who designed her own line of shoes.
Is she still an orthopedic surgeon, or?
Well, she is. Once you're an orthopedic surgeon, you're always. But I don't think she practices orthopedics.
Right. It sounds like she's doing fashion.
She's rolling in the dough.
She's rolling in it.
Well, I think you mentioned those shoes are not affordable for everybody. Those are like what?
They're pretty
$500 a pair.
Yeah.
So what about the person out there that wants a good, comfortable, good-looking shoe? Where should they go? Do you have any recommendations? You must refer to shoe places quite a bit in your practice.
I would go somewhere that they know how to fit your foot. That they're willing to work with you.
Would you send them to Maury?
No, and I wouldn't send them to where Maury worked either.
That's not even nice.
Okay.
But there are several places around here. Again, I'm not so sure we should name names,
right. But the thing
there are places that'll work with you, and that know shoes and that are just not trying to sell you a shoe.
Right.
And there's and for the men, which is which is our demographic we're talking to right now, there's a lot of really nice-looking men's dress shoes that are very comfortable because the women's shoes are really pointy and high heel, but the men's shoes, those square toe, there's a lot of good stuff. Like I could say Rockport makes a really comfortable men's shoe. And,
SAS, they're a fantastic shoe, but really ugly.
Right.
Very comfortable, but there are a lot of men's shoes out there that are a good shoe.
Yeah.
Well,
so that's not the problem.
I was just thinking about something. So if you make the correction on that bunion, is there a chance that bunion could come back after surgery? Yeah, let's talk about that.
That's the beauty of it, huh?
And you probably having a fellowship in foot and ankle probably have some statistical information. How often does that happen?
It depends on the surgeon.
Okay.
If you do the right surgery, and that's the biggest cause of recurrence, is that surgeons think they can take off the bump.
Oh, okay.
It's not a bump.
It's not a bump.
It's an angle. But you can sure make your patient happy for a very short term saying, you know what, we'll just come in there, shave that bump off. You'll be all good. Look how beautiful it is. And lo and behold, a year later, that thing's back. Oh, look at that. You must be wearing bad shoes.
So mechanically, you didn't correct it the first time around.
So then you should know that you should be going to the correct doctor then, right? And that doctor is...
I think it's an orthopedic foot and ankle surgeon.
That's what I want.
Yeah. So, what is the incident? Do a lot of people, are you seeing this a lot? Is there a lot of people out there? Is there a percentage of the population?
I see somebody every day with a bunion, or every week that have bunions.
Every week in your practice.
And most of them don't need surgery.
So, let's talk about...
They just need proper shoes.
They're not wearing the right shoes.
So let me ask one more question.
This is exciting stuff, isn't it?
I know, it is. It's fascinating.
Especially after 20 years of selling shoes.
It fascinates me, yes. Because I feel I could sleep now because I don't think I'm the cause. So if you do surgery for bunions and they go back to wearing pointy-toe shoes, is that another way that they can get bunions again?
Absolutely.
Okay.
Yeah, what about...
how often do you see that?
Not very often.
Okay, because they've learned their lesson. Because it's not very comfortable, is it?
They've caught on. It's not very comfortable. The recovery is long. It swells for even up to 4 or 5 months.
It's a painful surgery.
I've seen it,
I mean, you got to remember, you're cutting a bone and moving it and then screwing it
back together on the thing that you walk on.
Yeah, exactly, and that's why you're in a boot for what?
Well, you're in a post-op shoe for at least 8 weeks. Which is a flat shoe, not a whole boot.
But and it takes how many weeks for calcification? And
8 weeks.
8 weeks.
And how do you rehab something like that?
Well, I don't see them for. I mean, if I do see them, it's
they don't need it because therapists are great for motion, and occasionally they have motion problems through the MTP joint that we would send them to. But most of the time,
MTP is metatarsal phalangeal.
Sorry, you don't have to tell me that.
He knows.
I know that. I'm the co-host of Health Matters. I know that.
Occasionally they need some help, but most of the time just walking gets them going. So therapists don't have too much to do with bunions.
If they do need help, it's because they have weakness in that leg. I mean, a lot of times, or tighten their calf muscles, just because of not doing anything.
So as long as you're here and we're talking about this kind of stuff, what about all these pads that people put in their shoes?
They won't help bunions at all.
Right, yeah.
But they'll help a lot of other things.
How about like metatarsal pads?
Yeah, they can work great for metatarsalgia.
Okay. Yeah.
And so do we trust like some
Dr. Scholl's
that's selling shoes to put a metatarsal pad in someone's foot for someone's shoe for somebody? You know what I mean?
I think you would, and the fact that what I tell people with metatarsal pads is you have to just keep moving it around until you find the comfortable place. I can't look at a foot and say it has to be right there.
Yeah, good point.
You keep trying it, and you move it around, and feel free to fiddle. And that's the same with any type of orthotic or anything else with the shoe. It's how it fits you.
So I wanted to ask you, I mean, just while we still have some time, what about orthotics? I mean, I know that orthotics are used a lot for people that pronate, and a lot of times is the pronation or excessive pronation or rolling your foot in. Is that a bunion causer?
Yes, it can be.
So if I do an orthotic, then do you feel it helpful? Be honest. Come on. This is
not always for bunions.
Okay.
I think orthotics are mostly a well-fit pad, and I think that's where they're most useful. The type of orthotic that actually change things, I think you have to control the heel, and it's not a typical orthotic. It's almost a brace that goes in.
So if you have a tendency to have bunions and pronate, then when you go look at shoes, you want something with a strong, what we call heel box, and a really strong. Give me some ideas of some shoes as people that are out there might be listening.
Brooks has a strong heel box.
They have
A6.
Yep. Okay.
So New Balance, I think, has a strong heel box. They break down, but I like New Balance better because they don't have a high medial arch, which is what you want with your pronators.
They come in really narrow widths and really wide widths, too.
They do. They come in everything.
There's a shoe salesman in you.
Yeah.
Cash or charge?
They come in everything.
Cash or charge.
So
Wow, that's great information. I learned a lot.
I know, it's really good stuff. It's fascinating, the shoe business, isn't it?
It really
and
shoe business.
Proper shoe care. Oh, yeah, that's right. We're not talking about that.